Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Hi, I'm Dr. Roy Jensen. Thanks for joining us today for today's episode of Bench to Bedside. With me is Dr. Jamie Wagner, a breast surgical oncologist at the Women's Cancer Center at the University of Kansas Cancer Center, and clinical nurse coordinator and lymphedema prevention and treatment specialist, Sabrina Korentager. October is Breast Cancer Awareness Month, so it's an ideal time to call attention to advances in breast cancer surgical care and lymphedema treatment. Today we're going to focus our discussion on lymphedema prevention and its impact on patient care and quality of life for breast cancer patients everywhere. Sabrina, could you tell us what exactly is lymphedema?
Lymphedema is swelling, usually of an arm or a leg, that's caused by the disruption of the normal lymphatic flow. In our breast cancer patients, lymphedema most often will occur as a result of treatment for breast cancer, whether that's removal of a lymph node or radiation treatment. And so those areas that are affected can have a disruption in that flow. It's a necessary part of their treatment, but it can have a side effect.
So, but what causes lymphedema to occur in breast cancer?
So when I'm working with a patient, I explain that lymphedema can occur if you think about how a construction site happens. If you're traveling on a highway and you come across road construction, there's a part of the road that's disrupted. In the body, when we remove a lymph node, it's causing a disruption in the normal flow, much like road construction. If the body can't find a new pathway and isn't able to get around the detour, then the fluid that normally routes is unable to route. And then if that happens over time, just like a lot of cars will back up, a lot of fluid will back up. Over time, this leads to swelling. Chronic swelling may lead to other things such as pain, infection, inability to do your daily activities of living, decreased range of motion, and it really can impede a woman's quality of life.
So, Dr. Wagner, why is lymphedema such a concern, particularly among breast cancer patients?
Well, in particular for our invasive breast cancer patients, they all have to undergo some type of nodal procedure, whether it's a sentinel lymph node biopsy when we're sampling just those very first few lymph nodes that drain the breast, or with more advanced disease that has now invaded into the lymph nodes, some of those women have to have a complete X-ray lymph node dissection where we're taking out well more than 10 lymph nodes within the axilla. And so as a result, we know that women have a risk of lymphedema, whether it's 5 to 10% with just those few lymph nodes removed, but we also have the risk of 20 to 40% in those women that have to have much more extensive surgery. So we are putting all of these invasive cancer patients at least at a risk for developing lymphedema.
So what exactly are our breast cancer specialists, namely the both of you, doing to combat this issue?
We have taken more of an education, prevention, and early identification approach. Very similar to the accomplishments we have made with mammography screening, where we know that early identification allows us to identify breast cancers at earlier stages, and that requires less treatment to be successful in the treatment. That is the approach that we have now taken with lymphedema. So getting a baseline measurement, we know first and foremost is the most important aspect of what we do for our patients. So before we ever implement any treatment, whether it's surgery, chemotherapy, or radiation, we want to know what is normal for them. So we get that baseline measurement. Then after their treatment, we continue to follow them on a very routine basis. Again, very similar to mammography, where we recommend that be done every year. We're doing the same thing, that on a very routine basis, much closer in time frame in the beginning, and then eventually we will spread that time frame out just to be annual, but we follow them. And what that has allowed us to do is identify the early stages of lymphedema at what is considered subclinical stages. So before a patient can even identify it, before the older methods of tape measure, circumferential measurement had been identifying it, we're identifying this at subclinical stages. That has now allowed us to implement very modest lifestyle changes and modest treatments, most of which we can teach the patient at home, and that has allowed us to get patients back down to that baseline normal measurement, and it prevents them from going on to have progression of that lymphedema to a point that does impact their quality of life, as Sabrina had explained.
So that's really incredible. That's fantastic. So if you're just joining us, we are here with breast surgical oncologist Dr. Jamie Wagner and clinical nurse coordinator Sabrina Korentager discussing lymphedema treatment in breast cancer patients. If you have any questions for our experts, you can post them in the comments section. Remember to share this link with people you think might benefit from our discussion. Use the hashtag #BenchToBedside. Dr. Wagner, studies show that patients achieve the best outcomes when they obtain treatment in large volume academic medical centers. Why does that make such a difference, particularly for breast cancer patients?
Well, in particular, in these larger, such as NCI designated cancer centers that we have the opportunity to be a part of here at the University of Kansas Cancer Center, we know that those patients are being treated by subspecialists, physicians, and even nurses that are subspecialty trained within that specific disease treatment site. So with that, we understand that there is a broader aspect of treatment that's being implemented. We're looking at truly the multidisciplinary approach, and through the many years of research that we have, especially for breast cancer patients, we understand that that subspecialty training and the multidisciplinary approach of a team coming together to tailor that treatment strategy and that treatment plan for each individual patient and their specific tumor type really has the best outcomes.
Mm-hmm. So that's very exciting. So as we approach the end of today's program, what would you say would be the key takeaway that you want to give our audience to remember?
I think it's very important for patients to seek out the highest level of care with that very subspecialized multidisciplinary approach, because we know that patients treated at NCI designated cancer centers actually have a change in their breast cancer diagnosis by 46% by recent studies. And early identification across the board, whether it be their actual breast cancer treatment through good screening mammography performed annually starting at the age of 40, all the way to prevention and early identification for lymphedema. Prevention is the best method for best outcomes and survival.
Well, thank you, Dr. Wagner and Sabrina. That's it for today. Thank you for joining us, and we invite you to tune in next week, always Wednesday at 10 a.m., where we will have yet another topic from the KU Cancer Center. Thanks for watching.